Welcome to The Conversation. My name is Shannon Taylor. I'm the Executive Director of Blacks and Jews in Conversation. And with us today is an extremely special and attractive guest. I just throw in the word attractive to keep additional listeners. You'll get a preview of her in the background, but I'll give you a foretaste. So you don't have to look at me too long. Her name is Rosalia Dana Veru, and she is a Romanian. From Romania comes the hora, the circle dance, popular in the Middle East, not just Israel. It comes also Transylvania and Dracula from the macabre side. But there is also wonderful food and music and rich folklore of a very positive nature, and not just the more modern, the more horrific, and also a very sad history, history of oppression under Ceausescu that we'll hear from under the subsequent program. But tonight's program is not Romania. Tonight's program is medicinal. It's therapeutic. It's dental. It's laser. It's all the kind of interesting pyrotechnical medical work that, fortunately, I have not had done to me yet, but many people would like to experience. And as I'm not the best qualified to explain it, I'm going to turn it over to Dana after a preview of some of her credentials. She went to the University of Medicine and Pharmaceutics in Bucharest, Romania in the 90s and got her DDS in dental medicine. She then was a Master of Biophysics and Biocellular Technology in the University of Bucharest. By the way, I was in Bucharest. I took a lecture tour on the Danube, and I gave some of the lectures. There was very little water in those days. All we saw was big empty buildings, monuments to the folly of communism, and the water now is much fuller and richer. As a matter of fact, it's flooding the entire area. And currently, she's a PhD candidate with periodontology at the University of Medicine and Pharmaceutics. And the thesis title is The Effects of Low-Level Laser Therapy on Gingivitis and Marginal Periodontitis. God help us all, and I should suffer from any of this and have to look at any of this. Hopefully, every time I go to the dentist, I stay without cavities. Dana, let's get into how you started in this field.
In this field, I started by being a student in the dental school, and I had the chance to be student of the most amazing researcher in the world, which were Dr. Kovac, Dr. Agafița Lefter, and Dr. Sonia Herman. All three of them, they've been so resourceful, and they accumulate about 40 years of research and deep search into the biophysics and into the medicine and into the laser. And then Dr. Lefter gave me the laser in my hand 15 years ago to start to use it in the periodontal treatment. I didn't stop since then. I didn't know exactly what that was at that time. It was this device that looked like a lamp, which we would put on the gums of the patients in order to reduce inflammation. It took me 6 years to research and to study until I found out that that is called biostimulation and anti-inflammatory treatment that have short-term effects and long-term effects on the periodontal patient and into the bone growth, into the reducing of the pain, reducing of the bleeding, into reducing of the use of other medicine, and into stimulate the growth and regeneration and stimulate complete healing, as well in the periodontal disease and in the other fields of medicine.
Well, God knows how you were attracted to bloody teeth and gums. But it's certainly is hope for your beau, Tom Gass, who is a close friend of mine, a worthy attorney, that if you can put up with that, you can put up with him. and his very talented artistic son, Darius, who sang in the Met Chorus and is now performing downtown in the village with his own group. And I'd like now to explore with the current laser therapy technology in Europe and in America. Are they on a par? Is one superior to the other? Is the same technology available in the best hospitals? Because I'm told by the best doctors that the world is now one laboratory, that there really is no difference in the best hospitals and the best universities. Or is one place better than the other?
Is no place better than the other. All the world is one large laboratory and there's no borders for science. Science is everywhere and we have a big, large family, it's the laser family and science family. And we interact, and one thing is that America is so open to research and so open to new, and research and doctors here are so eager to know new things, and little by little, low-level laser therapy, which is also known as phototherapy, got a ground and started to get to be known, as well as for pain relief and for injuries, and then for arthritis, for using to the treatment of stiffness and muscle and temporary joint relief.
What would be the average complaint that a patient would come to you for? Not as a teacher, because I know you're certainly a distinguished teacher, but as a doctor in this field that would recommend the use of a laser to treat the gums and the teeth.
The patient will come to me as a periodontist to have a treatment for periodontal disease, not knowing exactly what would happen, what the treatment would be, but after having the laser treatment would realize that his healing, his reduced mobility, his secure results of the treatment had to do with the laser therapy. Over the treatment of laser therapy into the periodontal disease, we realized that there were many effects on the face. As we cured the periodontal disease, we found results on the face of the patients. Acne disappear, wrinkles disappear, reduce inflammation and allergy reaction on the face.
I understand that these findings were peculiarly your own, that you were involved in the pioneering efforts that found that the use of the lasers for the periodontal conditions coincidentally had good rehabilitative conditions on the facial conditions. Is that true?
On our own in Bucharest, me and Dr. Lefter Agafița, we found a bone growth into the treatment of periodontal disease, which is the reason that this wonderful country, America, gave me permanent residence here as a researcher on my research on the bone growth induced with laser therapy. But it's not my discovery that the laser therapy, it works wonderful on the acne and on the wrinkles, on the inflammation at the level of the face, which is a superficial level for the phototherapy induced with the light.
Now, do you treat all ages the same way, or does the skin vary with the age and therefore require different use of ages, different use of lasers depending on the age?
It's different use depending on if it is a chronic inflammation or if it is an acute lesion, if it is a patient that have osteoporosis, if it's a patient that have chronic and renal deficiency, if it's a patient with heart disease, or if it's a patient that is healthy and just have local inflammation. Depends also if it's a young patient or if it's an old patient. Depends on the level of water into the cells, because the laser have an effect and the level of the DNA and affects the chromosomes and makes a DNA repair and have an effect on the membrane of the cells into the channels of natrium, potassium, and calcium, and induce the mitochondria to work better and give the energy into the cells in order to function better. Laser is an ecological treatment that makes the cell heal itself without medicine, without pain relief medicines, without antibiotics. It has an antibacterial effect and the biostimulation effect that makes the healing immediate and very sure with no recurrency.
In your research, was it necessary to use repetitive research on animals, or was it able to be done without animals?
Never research on animals. We never did research on animals. We only did research in the dental clinic and then into the aesthetic practice on our wonderful patients from Romania. And we had a large variety over the last 15 years to study and develop treatments as we thought is best and as we found out from a treatment to another, from a patient to another. It depends on the age. A patient that is young and have osteoporosis and have stress-related periodontal disease is different from a patient that is 55 years old woman with hormonal deficiency and other problems related to the age. Very different results depending on a case to another. In all cases, we found in the favor of laser therapy.
You see, here's a perfect instance where the argument that you must do all medical research with animals fails completely. And you were able to complete your research with humans without doing damage to them and without doing damage to your medical advancement. So hooey on all those out there who claim that we must butcher and torture all our animals in order to advance ourselves. Am I right?
I never try and I will never do any research on animals. You're right, Shannon, and that's the way we do. That's the way we do.
Now, I'm going over the rest of your history, and I see you won the Best Paper Award in 2002 for the International Conference and the European Union, Florence, Italy, for laser therapy used in the treatment of cystic granuloma. Now, what, God help us, is that?
At the end of the root, if it is a bacterial infection at the apex of the tooth, it happened to develop a bacterial infection that is called granuloma, and then it gets an envelope, which is the cystic envelope that covers completely the root apex of the tooth. With the laser therapy, we were able to induce a stimulation and induce a bacterial healing and an antibacterial effect at the end of the root, and as well into a systemic effect on the patient, and the root healed into 4 weeks. The treatment that we did was at the level of the bone. It was a hole in the bone on the about a size of a cherry seed that with the treatment of the laser it got destroyed, and we got bone recovery in the next 4 weeks. This treatment is very effective on the 3 root molars or 2 root molars that in other case will need to have surgery with the removing of the crown or removing of the tooth. Those are the election treatments in case of cystic granuloma. With the laser therapy, we were able to remove the infection and to cause bone growth with completely bone recovery at the end of the root in just 4 weeks. We were surprised of the results, and we found them over and over again in our clinic in Bucharest.
Now, periodontal disease means disease of the gum and the bone underneath the tooth. Am I right?
Yes, periodontal disease is a bacterial infection that attacks the gums, the cement around the tooth, and the bone and the ligaments. Perio means around the tooth. Left untreated, periodontal disease will cause the tooth loss.
And it results in all kinds of terrible conditions if untreated that affect the gum and cause bleeding and cause infections, and they can spread into the jaw. Is that correct too?
Yes, there are favorizing factors that help periodontal disease to get set. Genetic factors, osteoporosis, hormonal factors, use of other medication, hormonal medications and heart medications. Another is pregnancy, heart problems. If the bacteria and the periodontal disease is continue, then will go and attack the heart and will attack the articulations and the liver.
All right, so thank God my heart and liver are not in danger from this yet. They're in danger from everything else, like doing this show, but they're not in danger from a disease that I have. One of the few diseases that I was told I was going to get that I didn't. Now, I noticed you've made many publications over the years. Phototherapy in gingivitis, periodontal affections and leukemia, laser and gingivitis, and statistical evidence of laser therapy benefits, and so on. And this is in Greece, and this is Romania, and this is all around the world, I see. Is there any, and Florence, what is the attraction to Florence for publications and for lectures? I know what it is for art, but I didn't know that Florence is still a city for medicine.
There is the heart of laser therapy. There is Professor Leonardo Longo with his family, and they organized the most amazing conference that there is for laser therapy on the face of this earth. When I first arrived there 11 years ago, I said, I arrived home. There it is, my language. I can speak my language, laser therapy language, which was not common in Romania and was not common any other place in the world I went. So then I went to Laser Florence and found my own kind of doctors, and we started to talk and to learn from each other from different departments, from dermatology, from gynecology, from heart disease, from all, and we explored and we shared our results so that we grow and learn better into benefit of the patient.
I can imagine in beautiful Florence with all those wonderful museums and the river and the food, the cathedrals and the temples and the performances, that you're stuck in this conference of doctors talking about bleeding gums and bone, but each person has its own thing and her own thing, and God bless you, because it's to the benefit of all of us. Mm-hmm. And if this is your crowd, you can stay with it. Now, you also have presentations on this. The last presentation in 2006 was the effects of phototherapy and so on. Is there something coming up in terms of a publication or a presentation or a doctorate thesis in the immediate future for you?
In September is going to be my thesis presentation, and then there are conferences all over the world. Especially these conferences are chosen in beautiful places, so we see the conference, we see the researchers, and also we enjoy the place. Next will be in South Africa. It will be again in Florence and into Arizona and into beautiful Prague and into Bern. And next year it will be in New Zealand. Now Florence have the conference in this Palazzo Vecchio, which is the most amazing building, sculptured and painted by Michelangelo. And we have all this beautiful entertainment that come with the conference. Everybody would think that doctors go to these conferences and they get bored, but actually the conferences have the ladies program, which are the ladies that are the wives of the doctors that get a separate program. In Florence, for example, ladies will go and get shopping for the Italian designers. In Japan, the ladies would go and have different fun and entertainment into the spas, and so on. Depends on which place it is. For the jealousy of our women doctors, which we have to stay in the suits and talk with the other doctors about dentistry and medicine, which is fun too.
I know the Palazzo Vecchio and the Florence. I've been up and down. It has so many floors, and on each floor it has more furniture and more paintings and more history, and it's across the river. You have to cross the river. If I'm right, you have to cross the river in Florence. That's where the flood took place. And they ruined half the art from that flood, and they restored it and so on. And then you get into the palace, and you climb the little hill, and it really was a treat. And believe me, I wouldn't spend 1 minute at your conference. I would hear the entertainment, I'd be with the ladies, and so on, and I'd be with the art, and you couldn't drag me to a conference on this. But God bless you again that you're doing all this, and I'm sure you're advancing so that I should never have this in my bleeding gum. I should never have a bleeding gum, much less a cavity. I notice you have community service for many years, volunteer dental therapy. You for children in Romania, for families in need. Then you have the Pinocchio Children's Home, a foundation of dental care, and the Casa Duro Victor Babies Hospital with HIV infection. God help you with bleeding gums with HIV, or that you apparently are fearless. But you're also a teacher. Tell me about your role as a teacher here in the Bronx.
It's not only in the Bronx, it's in Manhattan, in Queens, and in Brooklyn, and I want to send my love to my beautiful homegirls, which they've been an inspiration to me, and they've been so amazing and generous, and they taught me so much about America and how it is to be an American girl. They come from all over, and they're just fantastic, and they learn to become dental assistants, and they make my time really fun. Every day we learn. I learn from them, and they learn from me. And they also became my patients into the aesthetic field. Here in New York, where I have my practice, where we treat with phototherapy the wrinkles and the acne, and my students, they became my beautiful patients, different kind, either with the black skin, with marks, either with whiter skin, either Japanese, either Korean. And little by little we got to know each other and to learn that laser therapy was really useful from a day to another in each one of the cases,
So in other words, depending on the race and the color of the skin, you use different types of laser therapy, but the effects are always beneficial.
No, it's the same type of laser for all humankind. It's the same cells, and we are all the same at the end of the day. It's all the same.
So then explain again, how does it change based on the color of the skin in terms of the laser therapy? It doesn't change at all?
Laser therapy, no, not that I notice. If it would be hot laser, yes, but if it's low-level laser therapy, does not make any difference. Depends only on the water level of the cells, not on the color of the cells.
So I would think that the whiter the skin, the more problems you have. The more visible are the difficulty, and the weaker is the cell.
You might be right, but it's true that the whiter the skin might be more sensitive, but actually the more sensitive is the black skin, which can get very easily aggressed of depigmentation and scar damage because of the acne, because of the dense concentration of melanin.
Do the countries around the world have equal access to this therapy, or is it restricted to the cities?
2 years ago, my friend from Scotland and Japan, Glenn Calderhard, sent us an email and said, our days will come because FDA approved laser therapy on use of wrinkles, on use of pain relief, on use of stiffness, muscle treatment. And that is a great thing. If ADA approved our therapy, then will be space for this wonderful treatment that cause no invasive aggression to the skin and to the body to take place, reducing the use of medicine, reducing the use of anti-inflammatory and antibacterial treatments, with a great benefit to the patient. The treatment will cost much less and will be in less time and less aggressive to the body.
What do you foresee for your future? More teaching, more publication, more lecturing? What do you prefer? More practicing once you do your thesis, or more of the community service?
The patient. I will do the patient. Either is in a volunteer way or either is in my practice. I love the patient and the patient loves me back. The patients as a doctor have to be 90%, but always the research have to be 10%. A good doctor is going to research and read and study so it gets smart.
I want to thank you so very much for coming and sharing with your skill and expertise and knowledge. I want to wish you a very successful future worldwide. I wish I could come with you on these travels and journeys, especially to places I've been like Florence and Greece I would love to go to. And I welcome you back for our next show on Romania. Thank you.
Thank you so much, Shannon. And I want to tell you that over all my traveling in 22 countries, it was never